Online patient portals and telehealth provide an opportunity to increase access to care, particularly during the COVID pandemic, but they also bring the potential for increased disparities in access based on language status, race, ethnicity, and health literacy. Patient Gateway is an online portal where personal healthcare information can be accessed more efficiently. Requesting refills, sending non-emergent questions to providers, scheduling appointments, and conducting virtual visits are just some of the features on Patient Gateway, which has now been translated to Spanish and Portuguese. Data from the MGH Community Health Centers demonstrates disparity in active Patient Gateway usage among pediatric outpatients and their caregivers based on insurance status, public versus private. But prior to this study, we did not have data on rates of Patient Gateway enrollment among the pediatric inpatient population. Our specific aims were to characterize rates of Patient Gateway enrollment among pediatric inpatient population at MGH starting in January of 2021, with data analyzed by insurance status, preferred language, and age group. Our second aim was to use quality improvement methodology to increase rates of Patient Gateway enrollment. Our inclusion criteria were patients discharged from the Pediatric Hospitalist Service on Ellison 17 and 18 from January of 2021 through August of 2021. Our outcome measure was an EPIC discharge report of Patient Gateway enrollment status for patients within 2 weeks of discharge from the Pediatric Hospitalist Service. Our first intervention was to train pediatric hospitalists on how to enroll patients in Patient Gateway, including presentations at group meetings and distribution of tip sheets. Along with this, we introduced a dot phrase for pediatric hospitalists to document discussion of Patient Gateway enrollment status before discharge. Documentation of this discussion was required as an ongoing professional practice measure. Our second intervention was use of a patient navigator who met with families on the Pediatric Hospitalist Service to educate them about the benefits of Patient Gateway enrollment and provide hands-on assistance with enrollment in Patient Gateway.
Our results showed that at the beginning, we had an enrollment rate of 66%, around that percentage, and it was after our second intervention that we saw an increase in enrollment rates. For insurance status, we saw some disparities in enrollment rates related to private insurance versus public. For language, we also saw some disparities with having the highest percentage rate of enrollment for English speakers. And for age, we saw that the lowest percentage rate was for the 13 to 17 age group. In conclusion, Patient Gateway enrollment rates increased with the introduction of the Patient Gateway Patient Navigator, but disparities persisted by insurance status and language status, which could be due to accessibility of technology and related to topics of health literacy and parents' availability at bedside. Lower enrollment rates were evident for patients within the 13 to 17 age range group, which could be dependent on the additional paperwork that needs to be completed for this age group. Further directions include gathering feedback from patients and caregivers on their experience of utilizing the portal, continuing to identify and minimize barriers of enrollment, and examining the impact of Patient Gateway enrollment on clinical outcomes.